In this study, we looked at using liquid biopsy to find the genomic alteration in cholangiocarcinoma. As we know, cholangiocarcinoma is somewhat of a rare disease, and it is really difficult to get solid tumor biopsy sometimes to do next-generation sequencing to find out if there are any actionable targets. So in this study, we looked at real-world evidence of about 1,500 or so patients with cholangiocarcinoma who had NGS testing done through liquid biopsy. Yeah, one of the advantages, or a couple of advantages of a liquid biopsy. One, that you get the test results pretty fast. So within 1 to 2 weeks, you can know what are the NGS sequencing results as compared to solid tumor, where after we order, the pathology has to send to the company, and then company runs it, which takes about 4 or 5 weeks. So actually, with the results, you can actually start treatment based on the actionable target, if that's what you decide to do, early on, rather than wait for those results. The second, the biggest, I think, advantage I would say is, again, in cholangiocarcinoma, many times we just have FNA or very small number of cells and barely enough to make the diagnosis and don't have enough tissue to run the sequencing. So this will require repeat biopsy, another procedure which could have complications, as compared with liquid biopsy, which can easily be done through a blood draw test. So liquid biopsy is being routinely done, but this is the first time we're doing a study of like such a large number of patients where we looked at can we identify these actionable targets in liquid biopsy in lieu of solid tumor biopsy. Yeah, so here we found that actionable targets were actually at similar frequency that we find with the solid tumor biopsy NGS testing. So one of the always confusion was, can we detect fusions specifically, which are like FGFR fusion that we find in cholangiocarcinoma to target with FGFR inhibitors. And here we found the FGFR fusion in the range of about 10%, which is consistent with what we do in a metastatic setting with the solid tumor NGS testing. In terms of the next step, we are looking into outcomes. So based on these results, how the patients were treated with targetable therapy, and did they achieve some of the survival? So just proves that the value of doing the liquid biopsy. And also we'll expand this cohort to a much larger cohort with much more detailed treatment patterns as well.